In the end, it worked out. But you can never be sure. And let me tell you why. I had a patient, came into a clinic I was working. And this particular patient had chest pain during the night. He did the right thing. He called 911. 911 came, they did an EKG. It was borderline. It didn't show anything major, but sometimes EKGs don't show anything major. Sometimes the way people place them on your chest will determine how the reading looks. So if you're a woman who has large breasts, if you're a man who's like a big chest, the way leads are placed, they need to be touching are in between your ribs. It's very hard to touch people's ribs most of this day. So a lot of times they just slap them on. It may not be 100% accurate. So he came to the clinic the next day, and said, hey, I just need some acid reflux medicine. So as a nurse, I have to ask more than that because I know usually it's always something else that people need. They just come in with a minor excuse to get in. So I said, okay, are you having any chest pain, shortness of breath? You know, tell me about this acid reflux. So, oh yeah, I'm having chest pain. And so that's a red flag. That red flag goes off. I said, okay, so tell me about this chest pain. How long have you been having it? How severe is it? Does it feel like an elephant is sitting on your chest? He said, oh, I called 911 and, you know, now I'm getting really concerned. So he says, oh yeah, I called 911. They said it was fine. He pulls out this little wrinkled piece of EKG paper like, hey, look, everything looked fine, so just give me my acid reflux medicine. So as a nurse, I can't ignore that. Because if something happens, I give you this acid reflux medication, you go out to your car and have a heart attack, and now who's legally liable? Me, because I'm the trained medical professional. So I said, look, I understand that you just want this acid reflux medicine, and I hope that it's only acid reflux. However, to be on the safe side, I'm going to transfer you to the emergency room to make sure everything's okay with your heart. If it's okay with your heart, you'll get your acid reflux medication today, you'll go home. If it's not okay with your heart, then, you know, at least you'll be in the right care. So, never heard anything back about this patient, took him to the ER. 2 weeks later, he comes walking into the clinic with button-up shirt, his button maybe down to here, all this is open, and it's a huge scar from here all the way to his stomach. And I said, well, what happened to you? He said, you remember when you took me to the emergency room? And I was like, yeah. I had open heart surgery that same day at Duke because I had a massive heart attack, but I didn't feel it. So, when I tell you, when you have chest pain, don't ignore it, okay? Can we all agree to that? Even if it's little, even if it's like, oh, I think I'll be all right, please don't ignore it. Okay, so that's that story. So chest pain, shortness of breath, difficulty breathing, and I want you guys to know that there may not always be classic signs, especially for women. Women portray things differently. You may have a really, really, really awful stomach ache, and that could be a heart attack. So I don't want you to think that, oh, well, it's not chest pain, so I'm good. If you're having severe stomach pain, you're vomiting, you're sweaty, something just don't feel right. If you get a gut feeling that something don't feel right, go with your gut. Always, 100% of the time, it's better to get checked out and be okay than later on something happen. Because what may happen is you may be having a small heart attack, but small heart attacks turn into big heart attacks when they're not addressed. It keeps, because what happens is when you have a heart attack, a portion of your heart dies right then. If you can get immediate, accurate medical care, they need to kind of start bringing some more life, some more blood back to your heart. But if it's been a long time, your heart is not pumping the way it should, and guess what? That damage sometimes can grow and grow and grow. So then that's when you hear those people that have this massive heart attack just pass out and die. Okay? So if you have